Well, to get the very latest on what's happening in Belgium, let's bring in our Brussels correspondent, Dave Keating. Dave, what more can you tell us?
Well, the restrictions in Belgium are similar to that in France, but they're more severe in some areas, less severe in other areas. The curfew is nationwide here, not just in the biggest cities, but it's only from midnight till 5 a.m., not from 9 p.m. like in France. Now, that goes into effect today. Also, today, all restaurants and bars nationwide must close. It will also be a ban on selling alcohol after 8 p.m., and people are not allowed to have more than 4 people into their homes. You see a real focus here on alcohol because there's a idea from the government that alcohol makes people kind of lose their inhibitions and not socially distance or wear masks. So that prohibition on selling alcohol, also a restriction on any kind of outdoor crowd, outdoor gathering, and home gatherings is designed to stop people from just moving the party to another place, if you will. Now, these restrictions follow some tighter restrictions that were in place just in cities. Brussels, for instance, had already closed bars a week ago, but restaurants were still open. Now everything will be shut. This is, though, I should say, not really close to the full lockdown that we had here in spring. Lots of people here are calling this a second lockdown, but I should note that stores, shops, gyms, theaters, they all remain open and people can still leave their homes. They don't need an excuse for food shopping or medicine to do so, although people are now obliged to work from home if they can.
Dave, here in France, there was another new record in the number of cases on Saturday. How bad are things in Belgium?
Pretty bad. Belgium is approaching 8,000 new cases a day, and given Belgium's relatively small population size, that makes it one of the worst affected countries in Europe. Now, the cases, of course, are going up because more people are getting testing. Their numbers are about similar to what they were in the spring, but of course it should be noted that early in the pandemic in the spring, it was almost impossible here to get a test. Now it's quite easy, and we have this contact tracing app, Corona Alert, that's been out for a couple weeks now, where people get notified if they've been in proximity with somebody who has tested positive. But the government says that the curve of increase in the testing rate is lower than the curve of increase for infection numbers. Therefore, the increased testing cannot account entirely for the increase in cases. And of course, the key numbers to watch here is the hospitalization rate and the death rate. Now, those numbers are still relatively small when compared to the spring. But what has the government concerned is that they're increasing so much. The rate of increase is about 80% right now, week on week. And there's been concerns that hospitals here in Brussels might become overwhelmed and not have enough capacity. But still, over the weekend, I heard a lot of skepticism from people about whether or not these restrictions are too severe given the low number of deaths and hospitalizations. And of course, that the case number can be accounted by increased testing. The government, though, seems to think that the rate of increase of the deaths would mean that if nothing is done right now, the deaths would escalate very, very rapidly, like we saw in the spring.
Dave, thanks for that. Dave Keating there on the coronavirus situation in Belgium.